consistency beats intensity every single time.
Welcome to Agency for Change, a podcast from KidGlov that brings you the stories of changemakers who are actively working to improve our communities. In every episode, we'll meet with people who are making a lasting impact in the places we call home.
Hey everyone, welcome back to the Agency for Change podcast. This is Lynn Weinman, President and Chief Strategist at KidGlov. So a few weeks ago, we released an episode on women's health advocacy. And in that conversation, the guests touched on an issue that impacts every woman. And yet it is rarely talked about as openly as it should be. And that conversation actually led me to today's guest, Dr. Jayne Morgan. She is a leading cardiologist and a powerful advocate for women navigating, yes, I'm going to use the M word, menopause. And she is especially focused on when it comes to understanding that very real connection between menopause and heart health. So instead of our normal setup here, Dr. Morgan has so much to share. We're just going to step right into the heart of our conversation. Enjoy. So, Dr. Morgan, you know how this came about?
I don't.
Oh, well, I was doing a podcast on women's health advocacy.
Okay.
And in the podcast, Liz and Nada, who are my guests, they brought up menopause. And I think I blushed first. I am a woman of a certain age. I think I blushed. And then I said, I think I've never said menopause in public, and much less on a podcast that 500 to 1,000 people are going to listen to.
Isn't that amazing?
Right? And then they said, Lynn, you should be talking about this all the time. You need to talk to our friend, Dr. Morgan. And here we are.
Now is the time. So let's just get it out.
Let's do it.
Menopause, 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 menopause. Now we have said it.
All right.
Said it out in public.
And you know what? I am still blushing. And I know that's ridiculous, right?
But that's okay.
I'm 59 years old. I don't blush that often anymore. But yes, it's a topic that's a little bit taboo. So as we dive in,
that's exactly what we're working against. This, the veil of secrecy, the veil of silence, the veil of shame, the veil, let's not talk about it, the veil of suffering.
Right.
Enough. So that's okay if you're blushing. I'm not.
Okay.
So I can speak on your behalf.
Thank you. I'm not speechless. I'm just, a little bit hot in the cheeks, right? But it is ridiculous because most, if not all, women are going to go through it.
Right.
And why do we pretend like we're not, right? Why do we suffer in silence?
Right. We suffer in silence. It's in whispers and it's all reduced to hot flashes and night sweats. We have no other information. And here's the interesting part.
Right.
Doctors don't either.
Oh.
That's why I'm on this crusade. Doctors also have no information on it. We have no training on it. In my entire medical training, that's over 10 years, medical school, residency, a cardiology fellowship, the word menopause was never used in a lecture, in a textbook, on an exam. I completed 10 years of training.
Yeah.
I'm a cardiologist, and never once did I hear the word menopause.
Wow. Okay. Now, because you've already, just in a short minute, you've made me blush, and now I'm going to pick my chin up off the floor, right? And I think this is a good time to have you tell us about your background, right? Before we go deeper into the topic, tell us a little bit about what you do.
Sure. So I am a cardiologist, and I am the vice president of medical affairs for Hello Heart. It's the digital heart health company, as we work on empowering people to actually have some agency over their own lives and their own health. Imagine
Yes.
that. And especially for women, it's especially important for menopause. And we focus on that in my company at Hello Heart as well. I am a cardiologist. So did all of medical school, all of my internal medicine residency, all of my cardiology fellowship. So I am supposedly adequately prepared to
Okay.
take care of the population. And yet I have learned in my experience
Mm.
that really had very little to do with my training that I am inadequately prepared to take care of 51.2% of the population, which are the
Wow.
women. And
Wow.
I learned that later in my career, as my career wound through research and when I say research, I mean real hard R&D, research and development. I worked in pharma. I worked
Wow.
at Solvay Pharmaceuticals. I worked at AbbVie. I developed protocols. I enrolled people into clinical trials. I traveled all over the globe, giving lectures and speaking with our principal investigators. I was hardcore R&D, so I understand
Yeah.
how clinical trials work. And all of these little bubbles occurred in my life where I lived in different bubbles. I was in my training, that was my little bubble. Then I went out to practice, right? That's my little bubble as a new physician. I went into research. I'm in another bubble that seemingly is, unrelated.
Yeah.
And but it turns out that all these bubbles eventually, this is how the brain works, you start to intersect them.
Yeah.
This is what life experience is. And when I intersected all the bubbles, right in the middle was a big hole on
Mm.
women.
Mm.
And I realized that in my practice because in my training, because when we admitted women, we often describe their chest pain as atypical. And I noted I don't ever admit men and I'm describing their chest pain as atypical. Why am I
Interesting.
describing women's chest pain as atypical? And when you think about that word drives action or inaction, right? Basically, atypical triages you to a lower level of care and concern. You will not be moving forward with more aggressive therapy as your male counterpart will with classic. We call the man symptoms classic.
Classic. Oh
Chest
my
pain,
goodness.
shortness of breath. So there was that bubble where I'm having a question in my head. What am I imagining this or only the
Yeah.
women? But nobody else was talking about it. Of course, I'm at a training program of all men. So it's like is this me or what is happening here?
Yeah.
Going to research. I'm enrolling people in trials. I realize I don't really see a lot of women in trials. I don't really see a lot of minorities, but I bring it up. It's not really that important. The same as in my training. So I'm just working, and yet I've got this in my head, right?
Yeah.
And so you go and you're living in all these little bubbles. And here I am at this part of my life, and I started to intersect those bubbles because I've been in all these different places and I've seen these moments everywhere I've been that were blind spots to the people around me. And now I have the ability to bring that together to say, you know what? At the center of all these bubbles that I've been in are women and menopause. And so atypical was not my imagination. The research was not my imagination. It was me bringing a different lens and a different perspective to the table that the men there were unable to see and unable to accept. And I was unable to move forward with it because I was not in a position of power.
Right, right. Wow. So I'm picturing, I love the dynamic of how you're explaining this. I'm picturing all of these little bubbles
Right? That you
floating
live
around.
and work in. Right.
Yep. And I'm wondering, how do the bubbles then of cardiac instances or
Uh-huh.
cardiac disease and
Uh-huh.
menopause come
Right.
together? How do they intersect?
Yeah. And so yet another bubble. So
Yeah.
COVID hits and
Mm.
I began, here's my next bubble,
Yeah.
do more public relations, community service, social media. I start publishing data on COVID patients, especially with regard to minorities and minority enrollments into trials. I start speaking out about it. I create a social media series called the Stairwell Chronicles, where I sit on my stairs and for 60 seconds, I explained something about medicine. It started with COVID and the vaccine, and then transitioned over into cardiology, which is what I am, and research
Yeah.
and women. And people started to listen and started to enjoy it. It was just 1 minute little snippets of
Yeah.
information. And in doing so on social media, I started to be connected with a lot of OBGYNs. The number one person was Dr. Sharon Malone, who's a very good friend of mine. And so I was already following her on social media. So I wasn't following any particular doctors. I was just connected with my friends.
Yeah.
And many of my friends were doctors. And so Dr. Sharon Malone was talking about menopause. And I would listen because I'm connected with her on social
Right.
media. And I was doing my Stairwell Chronicles over here separately. I'm in my other bubble. And I think I started to realize, and maybe she and I both started to realize at the same time, wait a second, there's some interconnectivity here. Because I was also talking about how estrogen impacts the heart. She's talking about menopause. So we came together on my stairs. We did a Stairwell
I
Chronicles
love it.
and talked about what we began to first explore what that intersection was. I think Sharon and I were the first ones to really explore there was a connection between
Yeah.
cardiology and menopause, and it is not small. There is a huge connection here.
Wow.
So here was yet another bubble that I was in media, social media, public advocacy, speaking about COVID, trying to educate people. So I went into this other bubble and social media
Yeah.
and began to find other interconnections. And so all of the areas that I've been in life that you think are not connected,
Right.
all adding up to an experience that's unique to you
Right.
that then set me up to have a lens and a perspective that was so unique and sitting at the cusp of something that you don't even know how you're being set up over life, right? And this is was not short. I'm talking about over 2 or 3 decades. I spent 10 years in training, 8 years in pharma, but so I'm
Yeah.
literally deep in and learning everywhere I'm going, but I'm having questions. Everywhere I go, I'm having a question. I'm having a question.
Right.
So at the end of it, here, social media, I was able to start putting it together. So
Wow.
Sharon was talking about it. So through Sharon, I started meeting all of these other OBGYNs who were talking about it. I'm the only cardiologist there. I'm bringing this other lens and I'm going, hey guys, this is actually a cardiology problem.
Uh-huh.
Think about this. That's because I had been in all these separate and seemingly distinct and unconnected bubbles. And now all the bubbles were now intersecting
Yeah.
in menopause. Yes.
So let's add another bubble because one of the things that I hear from family members, from friends, from people I work with is there's this thing that happens. Women doubt themselves before they go into the doctor. They're like, is
Mhm.
this real? Is it not real? They go to the doctor. They've taken time off work. They've found time in their busy schedules. They go, they sit in the waiting room, they sit in the room. Their doctor comes in and kind of, pats them on the head and says, just settle down.
Call it the there.
Oh,
The
the there.
there,
Yes.
there.
Like I've
Yes.
never actually been patted on the head, but it feels like it.
You're
It's like,
patting on the back. It's the I know best. You poor
yes,
hysterical woman. Let me
right?
give you an anxiety medication.
Yes.
Maybe you
Drink
should
less
take a
coffee.
vacation.
Yes.
Yeah, why don't you rest more? Maybe you should go part-time at work. Here's an antidepressant.
Yes.
We can't find anything
Yes.
wrong with you. All of your labs are normal. I call it the
Yes.
labs are normal.
Were
There,
you at
there.
my last appointment?
Yes,
This is making
yes,
my eye twitch
yes.
just having this
That's
conversation.
right.
Yes.
That's right.
Yeah.
The proverbial there.
Yeah.
That's right. I call that
So
that.
what's happening? B, what's the down what's the downside? Should we all just go home and drink less coffee and
Yeah.
meditate more?
Yeah. Well, there is some data that coffee is actually good for your heart. So I don't know if
All
you should
right.
do less or not,
I'm
but
gonna have
so
another
that'll
sip
be
while we're
another
talking.
conversation. Right. That is why we're having this conversation.
Yeah.
Because for your listeners out there who are listening today to me
Yeah.
talk, at the end of this podcast, your reality may be that you now know more than your physicians do
Wow.
about menopause.
Wow.
That's where we are in this journey. So if you are listening, you are really out there on the leading edge.
Mm.
And you have to recognize that doctors, just like myself, have never had a single minute of training in
Wow.
menopause, have never had a single minute of a lecture in menopause, have never had the word uttered during their entire training period, like myself.
Wow.
The OBGYNs and primary care physicians, maybe they intersected with the word menopause, but I talk with them often, and many did not. And those who did, it was very minimal, maybe an hour or 2 hours or 4 hours. We're talking about 4 hours total of, I just told you, it took me 10 years of training.
Wow.
So their training is probably less, maybe 7 years or
Yeah.
8, but it's still, that's not nothing. So 7 or 8 years of training boiled down to 1 to 4 hours of menopause. Think about years of
Yeah.
what they're focused on. So was there an emphasis on that? No. Was there any deep dive on that? No. Did
Yeah.
did they did they pick up that this was something important? No.
Yet
This was just kind of
51% of the population will
there you go.
experience this and their lives will be disrupted.
Will be disrupted and changed. So, what I want your listeners to know is it's not your doctor's fault. So, do
Okay.
not get angry. We
Okay.
have learned everything that was put before us, that was required in our medical training, and are doing our best to take care of you. They literally have never heard the word menopause as
Wow.
part of medical training. So, you may have to do some doctor shopping, not in an angry way, like, oh, my
Right.
doctor so stupid. You just have to say, you know what? You have done great for me the
Yeah.
last 20 years. You have taken me through some tough times and you have really kept me healthy, but I need something else now at this stage
Yeah.
of my life. So I'm going to move to another doctor. It doesn't mean that I don't love you. It just means I'm at a different stage and I now
Yeah.
need something differently that you're not able to provide. It's been good. I love you. I'll see you at your kid's birthday party, whatever,
Yeah. Yeah.
because they don't know. And then find physicians. We are increasingly getting people on board. It's not
Right.
fast. It's not fast, but we
Right.
are getting people on board. I write about it all the time. I'll have an edition coming out in May with Atlanta Medicine Magazine. So you'll
Okay.
in doctors' offices across, the city of Atlanta. So we publish, we do social media, and so we're doing our best, and people are listening. We're starting to get legislation passed. I
Mm-hmm.
got a resolution passed in the state of Georgia in October of this year.
Amazing.
Uh, so people are starting to take notice. They don't exactly, when I say people, I mean physicians. They don't exactly know what's going on, but hey, am I supposed to know something about menopause? I'm hearing a lot about it because it's still not in our guidelines. If it's not
Right.
guidelines, it doesn't exist, right? So
Yeah.
hearing some chatter outside the guidelines, what's going on? And their patients are asking them, they're unprepared. It's not in our guidelines. It's never been in any of our training. Their patients, some of them are asking about it. They're hearing doctors like me, their friends chatter, and they're going, what is happening? What does this mean? I don't
Mm-hmm.
know anything about it. And does it relate to me in my practice? I don't know. I'm a rheumatologist. Why would I be concerned about menopause? Because menopause affects the bones and muscles,
Yeah.
arthritis. So
Oof.
rheumatologists have to be involved. So there are many doctors and many tranches of specialties that absolutely have no idea how menopause intersects with them and so are not listening because that doesn't have anything to do with me. In fact, most of us, when we hear the word menopause, that's our OBGYN
Yeah, right. That is an
friend. That's
OBGYN
like
thing.
nothing. The OBGYNs take
Yeah.
care of that. Have you talked to your OBGYN? That sort of,
Yeah. Yeah.
that's what to stop because menopause is not, it's less of a gynecologic footnote and more of a cardiovascular inflection point.
Mm.
Your risk of heart disease will double during perimenopause, and that's because
Wow.
of loss of estrogen. The first heart attack in a woman is more often fatal than the first heart attack of a man. For all of these things that we are discussing, it is ignored.
Wow.
Recognize it. We are poo-pooed. We are there. Meanwhile, we're actually having a heart attack.
Wow. All
Yeah.
right. So this is a good time for me to ask. So now you've scared me. You've made me blush. You've made me pick my
Yeah.
chin off the
This is
desk.
not to scare anyone. This is to empower you with knowledge,
Yes,
information. I don't
fair.
want anyone to be scared.
Fair,
Yeah.
fair. That is fair. But what are some of the symptoms we should look for, right? Like, what are some of the things that,
There are so many symptoms, anywhere from
oh,
50 to 60, and that number is probably increasing. Listen, have you ever heard about itchy ears? That was the
no.
first symptom. Yeah, your ears start to itch. And the reason your ears start to itch is that estrogen loss thins the skin. Some of the
Mm,
skin that we have is in our inner ear. So the
wow.
indication we may have is our ears start to itch. Have you ever connected the dots to itching ears to heart disease? Those are
Wow.
literally your ears telling you, hey, your risk of heart disease is starting to increase.
Well, and I imagine if you even went into, if your ears start to itch, your probably first instinct, my first instinct would be, I'm going to go try to find some ear drops at my
Right.
local pharmacy.
Or an antihistamine, or like I
Yeah.
live in Georgia. We have all this pollen
Oh,
and allergy,
yeah.
is what I thought because I live,
Wow.
my ears were itching. Literally, remember, I'm telling you something based on my experience. I had never heard of menopause.
Wow.
I was a full-blown cardiologist in
Wow.
life. I've been practicing for years. My ears were itching, nothing. Then I had
Yeah.
go where you start to get dizzy. I went to a neurologist,
Yeah.
big workup. Neurologist could find nothing.
Mm.
Nobody asked me about menopause. I had palpitations. I went to a cardiologist. I am a cardiologist.
Yeah.
Between the two of us,
Nothing.
menopause did not come up. I didn't know
Wow.
about it. They didn't know anything about it. So I had a big cardiology workup. I was having all types of abdominal bloating. That's also because of your loss of estrogen and progesterone. And I was just living with it, like, oh, I'm always bloated. My primary care physician suggested I was lactose intolerant. So I'm taking lactate pills and trying to avoid dairy products because now I've developed lactose intolerance. So
Oh
I've got
my.
itching ears, palpitations, lactose intolerance. Nobody's telling me, hey, this is just menopause. And here's the thing that we learn as physicians. If a patient comes to you with a multitude of seemingly unrelated complaints, 10 different complaints, do not work them up for 10 different things.
Mm.
Patient does not have 10 different things.
Yeah.
Your job is to find the one syndrome that they have that
Right.
incorporates all of these symptoms. And so here I was with all of these symptoms, and nobody was putting it together. In their defense, nobody had ever heard of menopause.
Yeah.
So there was
Yeah.
no correlation. Nobody had anything to put that together. Even if you put it into your differential list, it doesn't come up with menopause.
Doesn't come up.
Menopause doesn't exist as a diagnosis. There's no existence. It doesn't exist
Wow.
in the medical world. So, yeah, even myself, a cardiologist, I went from doctor to doctor to doctor. I was having hip pain, joint pain. I was at the rheumatologist, at the neurologist for vertigo, the cardiologist for palpitations. I having itchy ears. I saw an allergist. I mean, the whole thing, the
Yeah.
whole, the whole thing. And in the end, there was no conclusion.
Mm.
I still didn't know anything about menopause. I just lived with it. After a while, the vertigo got better. They told me I'm a Pilates instructor, to do more downward dogs where your head is down, to try to reset your eighth cranial nerve and your vestibular system. It was just all this kind of stuff.
Oh my
Um,
goodness.
and I was just living with it, and weight gain was like, and I wasn't so much gaining weight initially as it was taking me longer to take the weight off when I gained
Right, right,
down.
right. Through our lives, we all kind of know. I
Yeah, we
gained
kind of
the
know, like, oh, I put
pounds
on a few
and
pounds. Now this is what I have to do to take it off.
yeah.
Suddenly my tricks weren't working anymore. They
Uh-huh.
were taking longer. It wasn't, so I was maintaining my weight, but I was starting to struggle a bit,
Yeah.
but these are the kinds of things that you incorporate into your lifestyle, and you're aware of them, but it's not really impacting you. I can still fit into all of my clothes, but I'm struggling a little bit more to
Right.
gain this weight. So that's really how it first started, that it was harder for me. I
Yeah.
was all the same things and it was taking longer. And
Yeah.
then it got to the point where not only was it taking it longer, I had to add more things, like an extra 30 minutes of exercise or restricted my calories even a bit more. So now it was not only taking longer, I had to even be more extreme. So
Yeah.
it started to be this hill that was harder and
Right.
harder and
And you didn't
harder to
feel
climb.
well. Yeah.
Right, to like even maintain my weight started to be like a thing. I'm like,
Oh
oh my
my
God,
goodness.
this is like a whole thing now.
Dr.
Yeah.
Morgan, I love this because it's been so enlightening and even has given me empathy for the medical professionals, right? Because if you weren't trained in this space,
Yeah.
I know every doctor I've ever visited truly wants to give me the answer I need, but sometimes it's not apparent. And if it wasn't part of the training,
And not a part of our
and
guidelines.
not a part of the guidelines,
There you go.
it helps me understand. So, for all the women who are listening to this episode, if there was one thing they could do this week
This,
to advocate for or help themselves through menopause and just their general health, what would you recommend?
so I would say first, make sure you tell yourself that you are not crazy. You are not,
Oh,
and
yeah.
that's the main thing. Secondly, I would tell yourself you deserve to feel well.
Mm.
So oftentimes women, we kind of soldier through.
Oh, we do. We do.
And just like me, I was living with abdominal bloating, taking lactate pills, struggling with my weight. It was just kind of like my new reality. You do not have to live that way. And I want you to know that even for myself, I was telling myself that my symptoms were tolerable and that I could live.
Yeah.
I want you
Yeah.
to take a hard look at what you're living with. And if you can't figure it out, think about how you're living now in comparison to how you were living 10 years ago. Like for
Hmm.
I'm popping lactate pills now. I'm exercising 30 minutes more. I'm doing downward dogs for Pilates at my vestibular. Think about things like that you've
Yeah.
now incorporated into your life. You're like, no, I'm fine. Think about what are you doing now
Yeah.
that's different from 10 years, because it creeps up on you. It just is like, oh, these are just little things that I'm doing. And ask yourself, is that the quality of life that you would like to have? And then ask yourself this next question: what kind of life do I want 10 years from now? And
Yeah.
if I continue in this vein of accepting my fate and adjusting my life to all of these new symptoms, then 10 years from now, I will be at even further risk of heart disease.
Right.
Why? I didn't address it because I didn't think it was important, and the health system didn't think it was important because it's a blind spot.
Mm.
So have the conversation about hormone replacement therapy. It's not for everybody, but I want you to have that conversation. And that may mean you have to doctor shop, because remember,
Right.
most doctors have not been trained on it yet. But you need to talk about what it looks like with estrogen replacement, progesterone, testosterone. You need to have those conversations. Secondly, if that's not right for you, or you don't want to even discuss it, which is fine, there are also vasomotor drugs, meaning drugs, also prescription medications that can control hot flashes, night sweats, if that's your predominant symptom, if those are the symptoms that are predominant for you. So what I'm saying, if there's one thing that you can do, I want you to be empowered to know that you're not crazy.
Yeah.
You deserve to feel
Mm.
as you felt 10 years ago. You don't have to live with doing downward dogs and taking lactate pills, exercising even more than I was already exercising as a Pilates instructor. And
Oh
as
my goodness.
you just can, at some point, you like can't do anymore.
Right. You have to sleep
Right.
a little bit,
Right.
right? Like you have to
Right.
sleep. You have to have
Right.
some fun. Yeah, I
Right.
love all of this. I could listen to you for hours and hours, but I know we're kind of closing in here.
Yeah.
Are there any great resources for women? Like if they
Sure.
wanted to follow you,
Yes.
what would you
So here are
recommend?
people to follow. Follow me for sure. Dr.
Okay.
Jayne Morgan.
Okay.
I am a cardiologist, and I have been really the first voice in this space
I
to
love it.
talk about cardiology is connected to menopause. Your menopausal symptoms are telling you that your risk of heart disease is increasing. That's
Wow.
what you need to think about when you're doing those downward dogs to reset your middle ear. What was missed is actually this is a risk factor for heart disease.
Yeah.
And you need to have all those preventive measures done at your physician's office. That means checking your cholesterol, getting your blood pressure under control, working on what needs to happen with your weight, having your LP little a specific type of cholesterol checked. These are all things you can do for prevention. If you're smoking, quit.
Mm,
If you're
yeah.
drinking alcohol, cut back on it. So these are things where you need to aggressively begin to address what's happening with you. So you can follow me, Dr.
Okay.
Jayne, Dr.
Okay.
J-Y, there's a Y in my first name. Thank you, Mom and Dad. That's better. Dr. Jayne, Jayne Morgan. I'm on Instagram and
Great.
on LinkedIn, Jayne Morgan MD, but I'm on a lot of other platforms as well, Threads and
Okay.
X. And on Facebook, you can actually find me at 40 million beats, FORTY. It's spelled out,
Okay.
million beats. That's actually the name of my menopause company. So
I
there
love
you go,
it.
clinical research term. So you can find me there. But Instagram is where I do a lot. And then
Okay.
other people to follow. Dr. Sharon Malone, who, as I said, she and I got together to actually first connect these dots. And she really has been out there leading it. And her Instagram is S Malone MD. And then, great people like Mary Claire Haver. Once, if you see her on Instagram, Mary Claire Haver, and a urologist, Kelly
Yeah.
Cass, and an orthopedic surgeon, Dr. Vonda Wright. So you
Wow.
people are, because we're beginning to connect the dots, that these specialties are important. So you have an orthopedic surgeon, you've got a urologist, you have OBGYNs, now you have a cardiologist who entered the
Wow.
space to say, no, this is all cardiovascular.
Wow.
So
Wow. We
follow us.
we are going to get all of those links in the show notes to this
Yeah.
episode too. So if you are listening and you want to follow all of these great experts,
And they're all different, right? These are all different.
yeah.
So if you follow me, I'm talking about the heart
Yeah.
and women and your heart health. Heart disease is the number one killer of women, and your risk of heart disease doubles during menopause. That's what I talk about.
Okay. Thank
Yeah,
you. Thank you
you're
so
welcome.
much. I can't wait. I can't wait to follow all of you. Once again, I'm seeing all of these bubbles that you referenced at the beginning coming together.
Coming together.
Yeah.
Well,
Dr.
these
Morgan, I
are the
want to
unassociated bubbles, but here we are.
Here we are. I love it. I want to ask you one question that I've asked on every episode of the Agency for Change podcast. And you are so inspiring. You have so much to say. I've asked all of my guests for an original quote to
Uh-huh.
inspire our listeners. Can you give us a Dr. Jayne Morgan original quote?
I would say, and I don't know if this is original, but there are two things that I often say. Consistency beats intensity every single time.
Mm,
So be consistent with your preventive heart health practices. It is over time that you get those results. You don't just jump in one day and it's like, you know what, I'm going to be a triathlete today. Consistency in really all areas of your life beats intensity.
yeah.
And then something else I say, I'm in the pause, the M Factor Before the Pause movie. It's coming out tomorrow on PBS. March
Really?
18th. It's coming out tomorrow on PBS.
We're going to watch for that and get that link in the show notes as
I
well.
am in the movie, and here's what I say at the end. So now I'll give you the last comment of the movie is my comment.
Okay.
There are 7 days of the week, and someday isn't one of them. So I
Oh,
want you to take care of your health today. But what do women always say? We'll do it someday. No, 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 no. There are 7 days of the week, and someday is not one of them.
I love that so much. Dr. Morgan, this has been such an inspiring and informational conversation.
I'm glad we got it. We got it going. We were
I know
struggling with our calendars.
you're a hard person to schedule, and I completely understand why. I feel so lucky to have this time with you. I want to say, I believe the world needs more people like you. more doctors that are doing this good work. And I just so appreciate you taking the time
Thank you
today.
so much. I appreciate the invitation. And people, please follow me and you can send me questions right there. You can DM me right there, and I'm happy to answer your questions. And oftentimes on Wednesdays, especially, not sure what I'll be doing this week, but I post stairwell chronicles. So you will see me literally sitting on my stairs talking to you, giving you a little snippet of information that you can just file away and continue to grow.
That sounds fantastic. We can all find 1 minute a
Right.
week to
Right.
to take care of ourselves better. Dr. Morgan, thank you so much.
Thanks. Bye.
We hope you enjoyed today's Agency for Change podcast. To hear all our interviews with those who are making a positive change in our communities, or to nominate a changemaker you'd love to hear from, visit KidGlov.com at KIDGLOV.com to get in touch. As always, if you like what you've heard today, be sure to rate, review, subscribe, and share. Thanks for listening, and we'll see you next time.